I keep thinking there has to be some some cocktail of drugs or something else that can stop the platelets or whatever it is, the plaque from building, the blocks. I don't really know what to do but I guess my question really is, should I just walk like 200 miles a month? I'm pretty sure it's going to reblock in 3 months to 6 months. It'll reblock. So what do I do then? I'm not really a fan of bypasses unless there's a tremendous, experience. I want a proven technique.
A lot of what we do in this profession, understanding that we can't just change your blood vessels because that's the cards you're dealt with, is bring that inflammatory, reaction to as low as possible, with some of the cholesterol lowering medications, with some of the medications that we put on our balloons and some of the stuff that gets sprayed into the stents. But at the end of the day, the long game is give you enough oomph so that you can go and keep knocking those holes and walking, because there is a chance, and a pretty good chance, that let's say after a few times that you do that procedure and you're going through these ups and downs of oxygen necessity, that through walking you are expanding the amount of what we call vascular endothelial growth factor, VEGF. And VEGF is a very potent signal in your arteries to build new arteries. And so what'll happen, hopefully, I hope for you that this will happen, is that you have been significantly improving your collateral pathway. And that what'll happen one of these days is that that stent may occlude and you may not even feel it. And that the reality is that that day, even and I can tell you, I've got patients that run marathons that have got occluded stents. I don't necessarily just chase it, because at that point, your body has created enough passages around the blockage and a natural bypass made by your own cells that we don't need to chase that stent indefinitely till death. So keep in mind that I think if you're exercising routinely and you're feeling that with each one of these occlusions, less is happening, there may come a point where you may want to have a conversation with your doctor and say, is there any need at this point, doc? Because I actually just played 18 holes and that stent's 95%. Do I really need it open? Or do I have enough collateral? So I think that's something at least to look forward to.